Hey guys, good day. This is the real Dr. G, not the fake ones out there who don't help us and keep it real. Anyway, my name is Aneita Gaynair, and for those who don't know me, I'm a medical doctor. I'm a physician who specializes in family medicine. So I'm someone who ended up going through a lot. I ended up having an accident in 2006 and a big back surgery on my spinal cord. So if I was able to show you right now, I would show you the cut on my back, but I don't have on the right gear right now to show you guys, okay? So big up to everybody watching on Instagram and Facebook. Big up to Shaga, big up to Biggs. So anyway, so I'm about to do some laundry, and I was just wanting to tell you guys about how it feels to do laundry, and how when somebody have big back surgery like me with a metal rod right here in the back, how difficult it is to get some tasks done at home that you guys take for granted on an everyday basis, okay? So first of all, I have this big thing of laundry because I haven't been doing my laundry for a while because I have enough clothes first of all, so I didn't need to do laundry, but I need some clothes. I need certain clothes in here, and I'm like, you know what, it's piling up and I have the energy today. So with us patients who have spinal cord problems and nerve damage, guys, sometimes it's hard for us to get up and go and to get out of the bed. So I've been a little burnt out recently because I've been dealing with my son at home. You know, we're all going through the coronavirus, the COVID-19 lockdown right now, and we have our kids at home, and everybody's lives have been changing, right? So even though I'm used to being at home, I'm not used to everybody being at home with me and staying home with me. So I've had a lot of distractions, just like you guys, trying to get a lot of work done during the days, just like you guys. So I'm someone who goes through different types of pain, like from head to toe, and right now this is where it bothers me the most. Right now this is a discomfort that I'm feeling right now, and the only thing I've done from morning is push this. I push this all the way from the bathroom into the laundry room because I don't lift. I've learned from lifting that if I lift, then I'm gonna get way more pain, because I'm someone who went through a surgery and they end up putting a metal rod right here in my back, okay? So I have a rod, a titanium rod right here instead of bone. So I don't have a backbone right here, for those who don't understand. So it gets a little stiff, and I don't have that flexibility that you guys have in that top part of the back, okay? So when I say back surgery, I don't mean lower back. I'm talking about the middle of my back, because the back includes the neck, the cervical area, the spine, I should say. So the spine, my spine has been affected from the neck all the way down, that even when I touch myself, I touch my neck, my goosebumps start raising and my hair start raising up a while ago, and all I did was touch my neck. So these are the things I've been blogging about over the years, just trying to show people how my skin has even been sensitive to touch, and all I did was touch my neck to just show you guys something a while ago. So anyway, just keep that in the back of the mind, that I have this rod right here, right? So anytime I'm doing things with the arms and things, I have to be careful. So that's why you see me stand up that way and shift that way a while ago. So I tend to stand with a wide gait, a wide base gait, or wide stance, because it's comfortable for my pelvis. And the therapists have seen that over the years. They say that it's abnormal, and I tell them from as a little girl, we just stand up. So anyway, I always stand up wide with my legs wide open, just like my dad and my brothers. So I thought that was normal for me, but over the years it kind of my stance get wider and wider. So I've been evaluated by therapists, by rehab specialists over the years, and the rehabilitation and therapy actually make me sicker. That's how we find out that my nerve damage from the accident, the whiplash, has actually been contributing to my symptoms, guys. So basically, when I do things that even in the pool, even if I swim in the pool and try to do like the breaststroke, backstroke, breaststroke, you know, any stroke, freestyle, butterfly, I get headaches right here, and the pain and so in the back kind of comes into the ribs. So I try to keep up with everyone, try to do everything everybody do, but then the pain might come on, and I don't know what's gonna happen. Some things I kind of get used to, and I know when it comes on to stretch and to just wait till it ease off, but I don't know when these things are going to happen for true. So I've learned from the past that basically lifting up the laundry basket is going to hurt me. It hurts right in here no matter how strong I am. So the problem I have is that I am strong, and I want to lift things, and I want to do what everybody else do, but then the pain comes. So what happens with me now is when I put the laundry into the machine, I have to do a lot of bending and twisting to get this done, and to drop it into the laundry basket, into the machine to get it washed. And from that, doing that action alone, I get a lot of pain in my side. So I've learned to, first of all, not lift the basket, to push it. And all I did was push it to come in here so that I can start the laundry. All right. So I'm going to shift the phones a little bit so that you can kind of see what I'm doing, because it was a little bit bright in here. Great, guys. So if you guys have any questions about spinal cord issues, or if you're going through pain and it's not being managed well, and so you can always call me and discuss it with me and let me know what's going on, and I can see how I can help you. I don't mind if people message me and let me know what's, you know, if they have, like, people been calling me about their disc problem that they have, and I did a quick evaluation and stuff to refer her to an orthopedist. But if you guys are having any spinal cord problems, disc disease, nerve damage issues, and you're not doing well, you can always link me, because I've had a lot of experience dealing with it myself. From, like I said, from the accident in 2006 is when my life changed. I've been living in pain for a long time and have to pay attention to shoes, my clothes that I wear. I can't wear tight things around here, around my back. It's like it just feels uncomfortable. So when I go out or go even walking, that type of thing, I have to be careful as to what I'm wearing, so that way it's not too comfortable and not squeezing me too much. Because if that happens, all that's going to happen is I'm going to get a headache. So they told me to get a breast reduction at first when they knew about headaches, so that way I don't wear straps or wear things that pinch on the nerve right here. And I couldn't walk properly, and I was trying to lose weight, continue walking, and I couldn't walk past 3 minutes. And I said something's wrong, because of the same thing I'm feeling now, like a pain come right here in the butt, is like right here in the back, and it comes to the side. So it affects my walking. But I realized like the accident did affect my right side. But then over the years after doing tennis, it's tennis that ended up aggravating my injury back in 2012. My son was away in Georgia for June, and I never forgot, because I had the time to go and play tennis and be outside in the natural air. Because I was working a lot in the office, and I wanted to just get out and not just go to just the gym. You know what I mean? So what happened is that I end up just finding out from a surgeon, from me just calling lawyers and stuff, telling them that I found out about a ruptured disc that people missed out on. I tell them that at least I treat the disc problem, and I couldn't sit down properly. I was very, very restless. So I couldn't sit without moving around. It's like one side would hurt, and then I would get up and go to the other side, and the other side hurt. So I found out I had a ruptured disc in L4-5 on the left side, and then I said no wonder the right leg was hurting so much. Who knows how long that was there, but a Jamaican doctor found it, thank God to Dr. Kingsley Chin. He was the one who found out that I have the ruptured disc, and made me realize that the hospital where I did the MRIs at did not read it. Even though I even went back there to the hospital at Florida Medical Center, I told them in the radiology department that that's something wrong, and I knew in my mind that, you know, something was wrong. And is a radiologist pointed it out to me too, that I had a ruptured disc, but nobody changed the reading. They did not adjust the reading. They didn't change it to the correct reading. So that is the types of things I've gone through, is that types of negligence. So my pain management doctor wanted it to be in writing and have a report, but he didn't get a report showing the ruptured disc. So I ended up seeing a brand new doctor, Jamaican doctor, orthopedic surgeon, and he reviewed my MRIs. And he saw the ruptured disc, and he treated me with an epidural without numbing me, without knocking me out. So either way, they did it blindly, and I was able to stand up like how I am now. And I could actually, at least I'm not so restless, and at least I can sit quietly without moving around too much. And then when it gets a little tight, or when I get a bit of a discomfort, I move around. So basically, what's been happening is that I wasn't getting better, the walking getting worse, and then I went to a surgeon in Plantation, Florida here, and Dr. Richard Foltz, he's an awesome guy, neurosurgeon. He's the one who saw the arachnoid cyst on my spine. He saw that the people who did the x-ray, the MRIs from the year before missed it as well. So not only did they miss my ruptured disc, but they also did not see the arachnoid cyst on my thoracic spine. So you will see in the body of my in my blog, the diagnoses, because I want you guys to understand about arachnoid cyst and about reflex sympathetic dystrophy. So the reflex sympathetic dystrophy is the whiplash injury from the neck, where I get headaches from the head all the way down the neck, down the back and down. It's like a line that go all the way down. And the best model for that, for seeing that nerve, guys, is the meridian lines in the acupuncturist office. When I went to a Chinese doctor here, he's an orthopedic doctor from China, and he opened up his acupuncturist office here in Florida. And I was doing acupuncture with him, and he couldn't understand why I was feeling so much pain from the needle hitting the nerve. So my nerves are very, very sensitive to needles, guys. And over the years, we've had to stop with the pain management, and no one can block the nerves around the metal, because the metal rod is there. And you can actually, I've had loss of bone already from the steroid injection. So we don't want to cause infection along the metal. We don't want to cause the bony problems like the loss of bone, like osteopenia, osteoporosis. So those are problems that can happen as well. And it's just a quick fix if it's going to fix anything. So ultimately what happened, I went back to surgeons at University of Miami to reevaluate my MRIs, and they saw that my spinal cord is still stuck at a certain point. At T5-6 is what it's called. So that's why I have to shift again. So over the years, I've had some nerve issues right here where I just feel this nerve just jumping, and I am relaxed, I am calm, ready to start my day, busy doing work, distracting myself, and I just I don't have any control over this nerve. When I've had severe sharp pains from walking, I've gone back to the chiropractor to get the electric stim, and the electricity from the back actually stimulate this nerve again too, and make me feel nauseous and make me want to throw up. So I've stopped the chiropractor too, stopped acupuncture and all those things in the past, stopped pain management. I've gone back to pain management even like up to a year or so ago, to tell them that I still want to check in with them and see if there's anything new, but there's nothing new. Pills are something that don't help, because like I say, from the, without doing anything, I'm already in pain, and when I physically do things, it get worse. So with me just twisting like that, twisting alone hurts a lot, and the lifting, so that's another reason I don't work. It also makes my bladder spasms up well. So even without drinking a lot of water this morning, I've ran to the bathroom a lot. So gynecologically speaking, I have a gynecologist who just logged on from Jamaica, Miss Tia. Big up to Dr. Davis. She used to swim with me. We used to be swimmers in Kingston. So anyway, Tia was just advising them about spinal cord issues, nerve damage issues, and I was just about to go into urinary incontinence. I go through that where I just really have to go right now. I have no warning. I never drank anything. All I did was turn on the pipe or use the blender to make a quick shake, and I had to run to the bathroom and just drop everything. Otherwise, I'm going to pee on myself. So a lot of people don't talk about those things because it's embarrassing to go through. So if you guys are going through incontinence or the urine too, think about spinal cord as a cause, because I had a tethered spinal cord and a cyst on it that they removed, and I still go through those symptoms. So another thing that happened is that it affects my stomach. I have a nerve damage to my stomach. My GI doctor checked my nerve, and he found that I have gastroparesis, where is the nerve affected. And so I don't have any problems with appetite. I don't have an appetite. I don't want to eat. But it's not good not to eat. It's not good to starve yourself, and it's not good because you lose energy. So when I don't eat, I feel extra tired, and then when I get that hunger is when I want to eat, and then I want to eat the whole place, and then my belly full and I feel even more comfortable. So I've been training myself that when I feel hungry like that is to drink a shake and trick my stomach, and don't eat too much of a heavy food at night time, so that way it's not too uncomfortable and my belly is not way out to there. So another reason I don't go out sometime, or people will invite me out for the same thing, is I might eat something thinking I can make it out soon, and my stomach just swells up, and it gets so uncomfortable. And I just have to and it affects my breathing, it pushes on my bladder too. So between the abdomen, the abdominal spasm, the gastroparesis and the bladder spasms, it gets uncomfortable and it keeps me home. And I rather just stay home and chill, watch some TV, relax, stay on the phone and thing, look at some things than to go out. So my neighbors, my friends kind of get used to me that, I can't promise you that I'm going to go. It's when I feel like it, when I'm up to it. So I might catch up with them later on. You know what I mean? Or I tell them, go ahead and leave me alone. Leave me. Because I don't want to mess up anybody's night. You know what I mean? So that's how I've been flexing still. I just go based on how I feel. So anyway, I was just in the middle of doing laundry and was just showing you guys that the action, just the action of putting the clothes into it hurts right here. Right here. So basically that is something I've been going through for a long time. I'm just going to be doing some laundry right now and just chit-chatting with you guys. So yeah, so basically my laundry has been piling up for weeks because of the same thing. You go through a cycle where I'm trying to exercise, do my walking. I've been doing some push-up challenges, which is something that I'm not used to doing as well, and that puts a toll on it's been making my arm sore, but it's okay. I don't feel it too much around my back. It's when I'm doing the push-ups I feel like, this stiff. So I've been doing the push-ups for people with mental health illnesses because I'm someone who have gone through a lot of stereotyping because of the restlessness, because I've been restless in pain, and because the pain is so like from head to toe, burning from head to toe. I've had to see psychiatrists, psychologists, everybody over the past few years to make sure that it's not a psychiatric problem, which is normal. That's okay. But just going through divorce and loss of job and you're just not working anymore and going through pain, that alone can make anybody depressed or anybody feel a little anxious. So that's normal. You know what I mean? So I've told doctors about how I feel and how medications make me feel down and out and don't make me feel like getting up and going, and they don't help with the pain. So I've been on many types of medication, nerve medicines, narcotics, apart from the nerve blocks and trigger point injections and facet blocks and disc treating the disc as well. I've gone through many different types of pills. The neurologist at Cleveland Clinic tried me on some antidepressants, and when she tried an antidepressant, it made my hand shake. And I told her that it was very shake for like a couple days, and that I don't know if it's the SSRI, SNRI, or whatever it is she was giving me, like effects or one of those things. Sometimes antidepressants help with pain, and it can help you with the mood, especially if the medicine's making you sick and feeling down. So I've tried different medications to see if it would give me the energy and stuff, but they give me side effects. They either make me feel even more down and out and don't want to get out of the bed, like they make you too tired, because people want to treat the nerve problem thinking that you're so wired. But I'm somebody who naturally wired, and before my surgery I couldn't sleep for days. When this all started, I could not sleep for days. Not one day. I'm talking about 3 days in a row not sleeping, and you feel tired but your body up. As soon as I lie down and turn my neck, I would wake up and I knew something was wrong. When everybody's sleeping, when I go to the emergency room and they give me some anti-anxiety medicine for the nerve, because that's what they did in the ER when this all started, before we find out about my spine with the cyst. I was going to the ER many times, and they blow me off and tell me go home. And all this time I had something on my MRI that was real. So I would go back, tell them the left side bothered me this last time, but today is the right side. All I did was drive to the airport with a car that had a stick shift, automatic shift. So I changed my car. I ended up investing in a Cadillac Escalade because I always wanted one, and I was able to afford it at the time, and I invest in stuff. Because I've had such rare problems and doctors really don't understand it, or they don't know what's going on, I've lost private disability benefits because they were not on the same page, and people, like I said, not reading the MRIs properly. They're not reading them properly, but my surgeon seeing them or other people seeing the MRI that still have a spinal cord that's stuck. So right now I'm just hurting here while I see me put my hand on my back just to see if it eases off, because I'm standing up. So it's one of those things where it's been a journey, guys, and I've been stereotyped, mentally ill, all these things. I've lost a lot of fluids from just bladder spasms, from peeing all the time, that I've gotten dizzy here in Florida and had to go to the emergency room to get IV fluids to keep up my blood pressure. I've been in Jamaica where I've been in the heat and think that maybe the heat might be better for me, the warm weather might be better than the cold. because the cold was stimulating my nerves, making my hands shaky when I am calm and relaxed. So I'm somebody who's a calm and relaxed person. I like to educate, and in Jamaica they didn't treat me well when I was having a heat stroke. So I even went on Facebook to show you guys my skin naked. I even went naked on Facebook and people thought I was crazy, because I really wanted to show you guys that how people are in trouble or trying to get help, and nobody really care or take me serious. So I had to be cooling myself off in my friend's home, drink a whole lot of water to get my blood pressure up, and to get rid of the dizziness and the heat that was in my skin. And all what was happening was that I was in the heat, just in the car, going from place to place, and the heat from just outside made me get a slurring of my speech. So I was having signs of a stroke, and it ended up being a heat stroke because I was not drinking enough water to keep up my volume. So the dizziness started in Florida first. Went to get fluids at the emergency room. They gave it to me real quick with the Ativan to cool down the nerves. So when I went to Jamaica, I told them that too, that this is what they did in Florida, but this is different. The speech different now, as slurring. So I drank a lot of water on the way to the emergency room, and it got better along the way. My speech actually was improving from drinking a lot of water, but they didn't hurry up and give me IV fluids because they're really not used to those symptoms. They're not used to someone coming in and telling them that I have a nerve damage problem and I'm losing fluids from peeing, and I really just want help with fluids. And I'm trying to speak while having a speech problem, and told them that, you know, someone didn't help me at home either. So I was upset about them not helping me, and that probably made my pressure go up, if anything, because, and I purposely drank like a whole lot of salt water to get my pressure up. So I've been in emergency situations where the spinal cord problem made me have to go to the ER, and so I ended up my family was concerned, brought me to the hospital, and then they ended up finally finding out that I have some bad blood tests that showed kidney failure and rhabdomyolysis. So when I keep telling people about my illness and that I need fluids, they didn't take me serious. And my blood test came back with low potassium at first, so that's probably from the peeing. Anytime you pee a lot, you lose potassium and you can cramp. My legs were cramping a lot for real, and nobody took care of that. They ignored all of those things. So I ate up a lot of food, asked people to give me water, just keep giving me water to drink, just like what I did in the ER. I did that in the hospital since people were neglecting me and didn't care. So I basically treated myself and continued to remind them that I need fluids. They didn't give me any, so they transferred me to another place, and when they took blood work, they found out that my kidney was failing and that I had rhabdomyolysis, which is when your muscles start to break down. So when you don't have enough fluids in you and you get dehydrated, not eating well, your muscles break down to try and replace that. Or when your kidney is failing, the CPK is an elevator or an indication that something's wrong with the kidney. We use that as a marker for the muscles as well, for the heart, for heart attack and stuff. So somebody did their job and did blood work, and I was like, told you so, told you so. So the lady gave me 4 bags of fluids, and they rechecked my kidneys and stuff, and they said that the blood work was fine and that I can go home, I can leave hospital. So I've had to be in hospital where people don't understand what's going on. They don't know how to treat it, the spinal cord things, and they actually make you get more pain, more distress and more trauma because they're not treating you the right way. So I do this to educate people, especially the doctors and nurses out there, especially the ones who have been doing bad at treating us. You know, sometimes people get busy in the emergency room and they're busy, and I've been there, to the emergency room where people just want you to get to the point and they just hurry up and treat you. That's how they treated me here in the US. You know, it's like, get to the point. I'm like, listen, dizziness, and it's new for me. Everything else is normal, but the heat is on, and all of these things are new for me. When I tell them about my skin changing color, turning red, that it's heating problems. Sitting and feeling dizzy is not normal. It's not like I was doing something, you know, running outside and then I get it. It's like a sitting or lying down and getting dizzy. So that is a sign of low volume, guys, that you don't have enough blood pressure in your system to keep up the pressure, and then it affects your brain. If you don't have enough fluid to the brain or blood to the brain, then your brain goes out of whack. And that happened to me last year. My brain totally went out of whack. I was exercising too much. I was feeling the energy, and I went out and walked, and after I went walking and got hot, I remember everything, but I was out of it. And so my family had to take me to hospital, and I was in there for 4 weeks because they were worried about my mental status and thing, which was good. And I had a big wicked sore throat infection and things, so they were watching me. They thought I had an infection in the brain. So all of these things happen from the heat, guys. So I tell you about the heat because it's hot out there now, and a lot of people are not exercising like they used to at the gym and thing. But you really gotta keep up on your water, guys. What happened with me is I drink the water, but I pee it out like crazy. So when I go out, Vanessa, big up Vanessa watching, I don't drink a lot. It's like I'll have a 1 Guinness or I'll have a little drink and I'll take forever to finish that drink because I don't like to go to the bathroom every minute. So what happened with me, I don't want to drink any water. I don't want to drink anything at home. And that's what I tell my urologist, is that since we're not doing anything about the bladder incontinence, I have to adjust it with lifestyle change. So just like how I know how to lift or not lift properly, not do the lifting and push the basket instead, those are things I adapted to. So what happened with me, I don't want to drink any water because I'm afraid to run to the bathroom every minute or I'm going to wet up myself. And so what happened in Jamaica when I was hot and overheating is I drinking the water, but my belly swelling up and getting full, and then I'm peeing. So what happened? My belly filling up of water. So I can't drink anymore. So what happened? My belly has this fullness. So no matter how I'm doing it orally, the bladder spasm up and the belly filling up, so I can't get the water in. So that's what happened to me, why I end up with a stroke. You know what I mean? So the thing is, yeah, so my underwear, my bingo baggy. So the thing is that you guys have to keep up on your water, yeah, man, star. I do my son on my laundry. Here, it's probably my son shorts. I feel boxers them too. Yes, me wear bingo. Want to you, Vanessa. We have to wear the bingo them more time, you know, man. Want to you. So what happened is I wait till the sun cool off. I will go walking when the sun go down. It's one of my friends on Facebook messing around with me. She say, yo, it's bingo that. That's why I like how the watch to make me laugh. So that's what been making me happy over the years, guys. Is I go out and meet people like Vanessa, like Lana, Driver, big up everybody out there who keep me happy. Them call me and say, yo, here somebody show us your panties. See the seat here. Blue today. Blue drawers. Cause you have some perverts out there, the man who see me push-up challenge, you know, man, you know, me gym wear, you know, man, and they don't stop bother me. I have to turn off the messenger. So after my surgery, right, I have this metal rod in my back. And I couldn't wipe myself. I couldn't wipe my butt properly. And I couldn't wipe my front. I have to just go to the front, drop it in there. Go to the back, drop it in there. So I told my husband from in hospital after the surgery, the moment I went to the bathroom, I knew something wrong. I couldn't reach past here. Because the rod is like right here. And I'm like, so how I wipe? Oh my God, how do I wipe? So I'm like, damn, somebody have to wipe for me. I've never been through this before. Yeah. So I told my husband, listen, we're divorced now, but I said, listen, can you like check the pharmacy and see if there's something that can wipe my butt with? And he came back with a tool, one long instrument. You put the toilet paper on the end and you click it and it drops off. It can drop off into the bathroom. So I thank God they made those things, and I could just sit and wipe from the back to the front and put the toilet paper in the bathroom, in the toilet, and keep going. But it's still restricting me, you know what I mean? What I did was jump in the shower. So I really enjoyed that the shower was right there, and I just wash because I had a little hose that comes off the head at the shower, and I just wash myself, you know what I mean? So anyway, so that's the type of thing I went through, and I said, no man, I need to lose some weight, because I was like maybe 260, but I don't know how big I was. Right now I'm 200, I put on about 30 pounds from last year. Why my arms them so big? I put on weight from last year because I got hot and was in hospital, and I ate up a lot. They say I wasn't eating properly, so I had to eat up the porridge and the food in there, and it's okay. So they made sure that I was well and eat up good and all of these things, and basically made sure I was fine and let me go. So I put on a lot of weight from then, and like I said, the exercise, you know, put it through a cycle where it called me pain and things. So I exercise for a while, and then I stop, and then I go back and stop again. You know what I mean? So anyway, I was telling you about the rod in my back and all the things I got through, because it was just so much to keep up with hygiene that I decided to do a tummy tuck. You know, people disrespect people all the time about doing surgery on your body and all these things, but my neurologist didn't know about the cyst on my spine. He told me to reduce my breasts. My breasts were like out to here. They were real big and heavy, and even though I had heavy boobs from when I was younger, I still swim, play water polo, volleyball, netball, do it, whatever, dive off a cliff, jump off a cliff. That's me. I'm a high functioning athlete, always busy, always active, doing things. So for me to be in this position, it is debilitating to go through all of this. You know, it is depressing to go through all of this because I've been so high functional in the past, you know what I mean? So anyway, so I decided I'm going to check out this plastic surgeon around the corner. So I got a good deal from Strax Rejuvenation. At first, I got a breast reduction that was covered under my insurance. Thank God to Dr. Sassani. He was a very good doctor. He said I should keep it C-cup so that it is proportionate to my body and all these things. So he did the breast reduction. And then after that is when I found out about the nerve damage. And then subsequently we find out about the cyst on my spinal cord. So what they wanted to do at the University of Miami is to basically just wait till my breast heal up first, and then they do the back surgery. So I had two teams work on me, the orthopedic surgeon and the neurologist, the neurosurgeon, sorry. So anyways, I'm healing up from this back surgery, not doing good with the hygiene. They're ignoring me at UM. They don't care about whatever I want to say, that I'm still in pain, still restricted. But the overheating got better. I used to sweat, and like I said, I wasn't sleeping for days. I was feeling like wired, like really, like, you know, want to talk, even though I'm somebody who just a natural talker when I'm ready, you know, but when I work and I listen and guide people, you know. But I found that all those things change, you know, talking, just up, and I feel tired, but it's like my body not ready to sleep, that type of thing. So it's like a tired but wired. So even when I tell them all those things, they think about bipolar disorder. Those are signs of bipolar, for example. I said, you know what, I challenged that. So I went to psychologists, got my whole evaluation. They said, no, I don't have bipolar disorder. I have like depression with anxiety. They said everybody can have that. It's no problem. But either way, whatever the diagnosis, whatever it is, it's a situation you're going through. So lots of people can go through situations and get over it. And you don't have a diagnosis of any type anymore. You can get over it. But for me, I end up with this rod in my back that's still causing me some problems because it's a mechanical thing that's there. So anyway, so it affected my hygiene. I end up getting the tummy tuck and the lipod, my thighs as well, because my thighs were big. I used to walk like this, walk like a duck. And it ended up making me walk a little bit better. I lost a little weight and thing around the handles. But either way, I was able to turn. So that's the thing, the problem I had was turning and wiping. So even now, when I'm in the bathroom, when I try to go from front to back, I feel a lot of cramping right in here. And I sometimes can't make it to the front and back. So I still wipe at the front differently and at the back. Because, you know, we teach our kids to wipe from front to back so that you don't introduce bacteria or anything to the vagina or the urethra. You don't want to get UTIs, urinary tract infections. So that is why it's important about the hygiene. So even if I had to do a tummy tuck to make sure that I can reach, I was determined to keep up my hygiene. So that's why I ended up getting that done. So I don't have any regrets. It was a thing that I had to go through. But the wound opened up. The cut right here just opened up. So I have a big scar from my tummy tuck right here because the staples, where I was allergic to the staples, and it spit it out. And they told me I can do a revision, a scar revision, where they cut out the scar. But either way, I don't know what they do, but it's like they do the surgery all over again and do it properly and try not to get you the scar again. So, you know, I don't want any more surgery because I'm comfortable with it. It don't bother me. You know, when I wear certain outfits, you might see a little ripple right there and thing, but it don't bother me at all. I don't want to go through no surgery and die from surgery that is not necessary. And it costs money. It's not something cheap either. I had to pay cash for that because that's not covered by insurance when you do the tummy tuck and the lipo. But the breast reduction, especially because of the headaches, that's covered by insurance. So I learned a lot about those things too. So, cut a long story short, I've had to refer patients to get breast reduction too because of headaches and back pain as well. but they never had to get back surgery. When they got their breast reduction, they did well, and they didn't complain after that, you know. So everybody is different. It just depends on what you're going through and what you are experiencing. So with me, it's like some things got better with surgery, some things were is the same, you know. And the more that I move around and do the exercise recently, guys, I've been getting less stiffness, less sharpness here. At first, when I was walking, like for the first, like let's say after 5 minutes, like it started out okay, and then after 3 minutes it hurt and hurt. I don't feel that anymore. It's like I push through the exercise and push through the walking. Even if I don't go fast, I still make my legs keep moving and do it at a pace where I'm like going. And it's, you know, it's like it making me more flexible back here. It's making me, you know, walk without so much pain. So like I say, you learn about your body as you go along, guys. Like I told the surgeon when he discovered the cyst, he told me that I'm really smart, and I tell him that he's not smart or smart. I told him that I just know my body. That I'm somebody who, even when I'm big and fat, put on weight, I always try to exercise and keep active, even if it's just to walk 60 minutes around the block, which is what I'm doing now. And I mapped out an area of like 3 miles, and I'm doing it faster. So my walking, I do the walking to get out of the house, get some sunlight, you know, get some air, fresh air, and then basically to keep up on the activity. It's not about losing weight. Hopefully I can lose the weight as I'm doing that, because I'm watching the food a little more and decreasing my calories. I certainly watch the food and eat it because the food nice. So I enjoy my food, I enjoy life, and I like to try new things. So even more reason to keep up on the exercise, so that way you don't put on too much weight when you're enjoying the food. You know what I mean? So anybody out there have any questions? Anybody want to talk or want to come on the live with me? You have any questions or concerns? While I'm here, I'm on Instagram. Somebody said they want to see me in my bikini. You gotta watch, you gotta check out my photos, man. Check out my pictures. You'll see me in my bikini on the boat. Not at home. You'll see me on the boat. I went on the boat the other day and I was in my bikini. You know what I mean? So anyway, I grew up in the grill in Jamaica, where I grew up on the beach. So that's why I love to be in my swimsuit. And it's a place where it's known for entertainment, for music. I grew up on the beach road where the band was playing across the street, the live bands. And music was always around, still is around. And then I moved out to the hills to live up there. And even then, music is still around in the hills. So I'm somebody who like to talk about music and a lot of different topics, because music gets us together. You know, music makes me happy. Music is like my medicine. So I like to go out and have a good time and dance. But the dancing hurt back here. Like I'll get down and out and, you know, do my little dancing and thing like that, and, you know, get down and do me broke off your back, and then me feel it right in here. But me try to do it, you know. Try to do the broke off your back, cause you know your body good, know your body good. That's one of my favorite songs. Know your body good. Broke off your back, broke off your back, broke off your. So me love music. Me miss going out and hear the music. But when I go out, I usually hold a corner, lean up by the bar, because my feet burn like crazy. So I always pay attention to the shoes that I'm wearing when I go out. So the reason why I go into so much detail, guys, is for a reason. Doctors don't care about all of the stuff that I just told you when you go for your appointments. It's not that they don't care, they don't have time. So people don't have time to listen. People don't know what questions to ask, because what happened, we might have like something new. Like, listen, I want some help with sleep. I want some help with this or that. You don't want to repeat and go through all the stuff that you've been through, because it's a lot. So sometimes as patients, we don't know where to start. We don't know how to, you know, how much to tell the doctor when we go for a consultation, especially one that's new. Because it is a lot that we've gone through. It is a lot that people miss. And and you want to get the help. You know what I mean? So what happened, I respect my family. Thank God to my family. They've been understanding more. You know, sometimes my mom would help me when she's around. She helps me with the laundry and stuff, because she knows that it hurt a lot to do it. But I tell them, don't worry, like, let me do it. I want to do it because I want to get things to do and keep active as well. So I tell them leave it because they get busy as well too. All right, so I just started one load of laundry and was just wanting to just explain what we go through as spinal cord patients when we're doing little things like this, and some of the symptoms that we go through on an everyday basis, you know, that people might not think about. So this is to educate especially doctors, nurses, lawyers. There are a lot of lawyers out there, or lawyers there, who have tried to help me to get back benefits that I lost, like private benefits. And what we realize is doctors not documenting well and not on the same page. You know, they'll say that my spinal cord is still stuck at a place, but they don't want to do surgery because going behind the metal is going to cause paralysis if they happen to like work on that part of my spinal cord. So basically my spinal cord has problems that they can't fix right now, which is okay. So the point of this blog is that it's not everything that is fixable, guys. I'm sweating like a pig in here. Good thing I brought this still. Let me just use this. So I just purposely closed the laundry room door because I didn't want you guys hearing any noise in the background. My son playing video games and having fun, which is awesome. But he knows that we're going to be going out for a walk as well. So yeah. So basically I just wanted to reach out and just show you guys what we go through as patients. Because the more we learn about these spinal cord problems and the nerve damage problems, we can help each other. Doctors will pick up on these things earlier and think about those diagnoses, because there's a lot of patients out there who are going through stuff that I'm going through and people don't know what's happening. So, or people don't know how to deal with the complaints. It's like they get overwhelmed, you know, they get a bit overwhelmed, and so because patients are going through pain from like head to toe. So me and my son, like, you know, when I'm preparing his lunch in the morning and I turn on the blender and I feel like running to the bathroom, there are many mornings when I'm preparing his lunch and I'm like flying to the bathroom and I hit up against the wall and bruise up the side of my leg, and so I have bruises, not so much like before because I don't drink a lot like I used to. So, you know, over the years I've adapted my lifestyle, whether it's drinking less water, you know, and doing less lifting. It has helped so that I don't get too much headaches. The twisting too is a thing that's been putting a toll on my ribs. So with all of that, that is one of the reasons why I don't work. And you're right, I would love to take off this shirt right now. You would never know, but I have on my bra and and it's not appropriate right now to show you guys that. You know, I prefer if I have on like a gym top, I can show you guys my scar and thing, or my swimsuit, but I have my bra on now, so we're not gonna go there right now. You know what I mean? So it's some people on Instagram bothering me because they know that I'm hot. Anyway, I don't have any plans this weekend, Vanessa, but if anything going on, let me know. You know, that's what I always say. You guys keep me in the loop, let me know what's going on around town, because things are opening up back slowly but surely. They have foundation Sundays in, you know, on Sunday, you know, over by the backyard headquarters. So things are going on. Things have been going on even with the lockdown. But, you know, things been slowly opening up back and thing, like I said, the park's been opening up back and thing. So, you know, but I've had my son with me and thing, and he hasn't been going to bed at nighttime. So I have to be up with him at nighttime, even when I'm tired and burnt out. So what happened is, yeah, oh, it's all on Facebook. They got flyers on Facebook. All right. So just share them with me or tag me up and send it to me. All right, Vanessa? Because that's what I do when I finish walking now, is I can catch up on some stuff and at home as well. All right. So what I've been trying to do is get up earlier in the mornings, and so to start the day earlier. But my son has been up. My son goes to I'm divorced, and I share him with my ex-husband every 2 weeks. So this Friday he's gonna go to his dad, so I'll be a little bit more free up in the next couple of days and I won't have to worry about his sleeping or not, and kind of catch up on my sleep cycle and catch up on some paperwork I need to do. So I have a lot of distractions going on right now in the house, so I can't get some of my work done that I want to catch up on. So between the pain and using the computer, the neck flexion, I haven't been doing a lot of work that I need to do, that I'm behind on and stuff. So what I do is slowly do that, you know, especially when I have the energy and I don't have the distraction. I sit down and get stuff done. So today is a day where I feel the energy to do laundry It's like I just got up like, you know what, I really need to do some laundry and get it done early, so the machine don't make too much noise later on when people sleeping, you know. Just try and get it done now, so that way I can get a load in. So I figured I would just, you know, start the blog and just do a little blog just to show you guys activity and how just doing chores in the house, washing the bath and those types of things, causes a lot of discomfort and burning pain. So it takes me a lot to do those things. So just be grateful for what you know, just be grateful, guys, for your health right now and thing. And just, you know, I just hope that none of you guys go through what I go through. Hopefully you don't have any accident and big back surgery like I've had. But if that's the case, then you just stick it out, you know, just hang in there, because things can get better. You know, that's always a positive vibe that I have, is that things can get better. So that's why I continue seeing doctors and things, to continue getting help and thing, you know, with everything. But when it comes down to the pain, I don't take any medications at all. I don't take any medications for anything. But I have some old medicines like muscle relaxant that I take occasionally when I want to knock out and get some sleep. But it doesn't kick in right away. It takes like hours, and then you feel drowsy, but it don't make me sleep. So all these medicines do is make you drowsy and tired, yeah, man, and they don't hit the burning pain. So I rather stay without pills, you know, and just have a natural vibe where I just follow my natural sleep cycle and just naturally fall asleep. But like I said, when I have a child around that I have to be paying attention to, that takes a toll on me physically and things, to have to get up and go. So I've been training my son how to get his food, how to warm things up in the microwave. I teach him how to get his own food in the meantime while I lie down a little longer. I show him how to massage, how to kind of help me rub my feet sometime. Those are the little things I teach my son. He's very, very empathetic, you know. So what I do is outreach, guys. I just like to educate and just show you guys what's going on with my health, so that one day, hopefully, if you know of anybody going through burning pains, unexplained pain, you know, especially headaches in the front, the side, the back of the head, you know, burning pains, just weird symptoms like, you know, tremors, you know, nerve types of issues, think about the spinal cord and think about arachnoid cyst, okay? Think about tethering. Tethering is when the spinal cord gets stuck. So what the surgeon explained to me is when I sit down, the spinal cord is not moving freely up and down the spinal canal. So what happens is getting stuck, and it makes me get a headache or get some type of pain, because it's just kind of not moving when I sit down like that, you know. So I like to stand up more than sit. But it might hurt my you know, feet. So I pay attention to shoes, to the type of shoes I'm wearing, so that way I don't wear anything too tight on the shoes. So like I said, a lot of these little details that we go through, the rehab doctors, family medicine docs, internists, a lot of the specialists, even, you know, generalists and specialists, they really don't ask you how you're doing at home and how are you doing with the functioning, you know, with your, what we call ADLs. I see, you know, just everyday, what they call activities of daily living is what we call ADLs, like brushing your teeth, combing your hair, just doing your everyday activity are your everyday activities. And, you know, just brushing teeth, combing hair burns like crazy up here. So I'm, you know, so I do it, but I might not have like a nice hairstyle, or I don't get my hair done like I used to because of the headaches. I used to get braids and get weave and all these things, you know, just like extensions, different styles, lovely styles. But they would pull. It pulls on my scalp and thing, especially here. I get the headaches here. So even the other day I did like about 6 braids, just a simple hairstyle, and I could feel it even when she done. I was like, oh my gosh, ready to take this out already. So as it loosened up, it feel little better as I go along, you know, and things. So I don't mind getting the hairstyles, but I'm not fussy about them. So I'm just glad to be alive. I'm glad that I'm alive. I'm glad that I'm able to share this information with you guys, so that way when you have spinal cord patients or people with heat strokes, or, you know, those types of issues where you have these neurological problems, then people can know how to treat us well. They can know the mechanism of injury or mechanism of the illness, so that way they can help somebody more in the emergency room or in your office. So I'm reaching out to the doctors, nurses, anybody who work in the health field or is affiliated with healthcare, to please document, continue documenting as much as you can the details, ask the right questions, and you know, that will help somebody as well. So if you guys have any questions, you can ask me, you can message me. You know, I'm a little bit behind on the messages. As I clear them out, it get full. So I really like the response out there. I like how people have been getting in touch with me. That makes me happy. It makes me feel like I'm doing something, that I'm doing work, you know. So I don't mind reaching out to people even with the pain, and it feels fulfilling when people call me and I can advise them about something. That is my job. I was put on earth to help people. So if you guys are going through something and you really want to talk to somebody, you can call me. Just message me and you can leave me a brief summary like, listen, I just want somebody to talk about something or the other, and you just let me know a little brief thing and I can call you back. Alright, I'm good about returning messages, and so it's just that there are people out there who want to say hi and, you know, thank you, do what you're doing, and you have some people who are just harassing and give trouble and just blowing up the messenger every minute for no reason. You know, they just want to talk to somebody, a lady and thing, and you know, that just gets in the way of even when I do in my lives. So I've had to turn off the messenger on the phone so that I can get my work done on the phone. Can't even do my work on the phone. So thank you for reaching out, guys. That helps us a lot. And even if you can support people like that, like support, you know, be in the background emotionally, that helps. Right now, I want to help out some people in Jamaica, in Montego Bay. I have some biker friends who are giving some care packages in their community to the people, and he fed like gave like 300 care packages the other day. So big respect to Buju out there and everybody else who's been giving back in their community during the coronavirus lockdown. Today, May is Mental Health Awareness Month. I've been doing the push-up challenge, so you guys share that for me, please, so we can get the word out about mental health awareness, so that people out there who are suicidal can get help. There are a lot of people committing suicide, especially during this time where it's a sudden change in their life and the virus is going around, and you know, a lot of people are dying out there from many things, you know. So it's a sad time that we're going through, where a lot of people have been, you know, it's a sudden life change for many people. I'm used to staying at home. I've suffered a lot of losses already and I've been recovering from that. So for me, it's not a big change. The big change for me is having everybody else at home all day. Like my son, for example, is here all day, so that is like a little distraction for me, which is okay, because I love his company. So you guys share the videos for me as much as possible so we can get the word out about spinal cord tethering, spinal cord arachnoid cysts, spinal fusion, like what I have with my titanium rod, gastroparesis, fibromyalgia. Those are the issues that I've gone through. And obesity as well is one of the diagnoses I have for disability. They actually count that in obesity, and it's so true, man. The weight can actually put a toll on you, on your back and things, so it's good to keep off the weight. So you guys, like I said, respect do out there, share the information for me, and if you guys have any questions, thanks a lot for the compliments and thing. If you guys have any questions out there, you can always message me or leave it under the comments. All right, so that's it for now. I'm gonna start my laundry, start my first load and things, so we get it going. So like I said, you guys have a good evening. Good. All right, it's Wednesday, the 20th of May 2020. So you guys have a great day, and if anything, we'll link up back later. All right, so that should be enough for now. Hopefully you guys learned a lot. I know I went into detail about even urinary incontinence too. So think about the abdominal spasms as well. Abdominal spasms, gastroparesis, urinary incontinence. Those are all symptoms of spinal cord problems or reflex sympathetic dystrophy or chronic regional pain syndrome. Okay, so thank you guys, and what I'll be doing every day is to continue doing my push-up challenge, but if you guys want to talk about any topic specifically, you can let me know. But I just wanted to do like a brief summary of what I've been going through, so you guys can kind of get to know me and why I'm raising funds as well. One of the things that I do is go out and liaison and network with people who put on fundraisers and stuff. So that's where I go out, get to know the promoters, because I've been doing fundraising from as a little girl and thing in Jamaica in high school and stuff. So So respect due for all of those people who donated towards my biker friends in Jamaica, because I'm a motorcyclist. And one of the things I've been wanting to do is to have a concert so we can talk about spinal cord injury when it relates to motorcycles or anybody in general, you know, and raise money and education for that. So we can get some MRI machines down there in Jamaica at the Sav Hospital. So I have a lot of ideas out there. I have a lot of ideas to give back. And this is my way of giving back, is educating guys and just showing you what I go through symptom-wise as a patient and what I've gone through as a patient. That a lot of people don't listen. They really don't have a lot of time, you know, or they have students they're training, other residents, and they come in and they might get a brief history and you're repeating to the same people, you know. So it can get a little frustrating, but I try to my best to take care of myself, you know what I mean? So you guys have to do the same. If you don't take care of yourself, nobody's going to do it for you, you know. And if you don't know what's going on with your body, nobody else is going to know something's wrong. So like I said, guys, just know your body like how I did. And I knew that something was wrong with the walking, and then I got it checked out. So don't be afraid to go to somebody new. Don't be afraid to get a second, third, fourth, fifth opinion if you have to figure out what's going on. That's what I've had to do, and I found out some things were real. Okay, so I've been, like I said, guys, treated as mental, or you know, they don't believe it, and the next thing you know is something really wrong physically. Okay, so I've been through some serious stuff, and I'm alive. At least I can walk. At least I can stand up, even though I'm catching off my leg right now. At least I can put up with the pain in the meantime. Alright, guys, so I'm gonna get a little rest right now, because just doing this blog and the little laundry a while ago, it hurting right here. It's very, very tender right here. So what I'm gonna do is plug in the phone, like put on the phone and just go and take a walk now. Just take a nice walk in the neighborhood, and you know, we do a little hour while the sun is out and thing before it get dark, and then basically just come back and chill out and do some more follow-ups. So I have to give my body a little break sometime, because it hurts like right here, very, very tender on this side for some reason. The right side acting up right now. Big up Misha Brown, big up Sharon, I see you coming on and thing. But go back to the beginning of the live. I'm not going to talk much longer. I don't want to lose your attention and thing, you know. I don't want it to be too long. So I'm just doing some laundry. I was just telling them about my symptoms, Sharon, how I hurt a lot in the side and goes down to the leg and the back sometime. And just a little time of blogging and doing the little laundry, putting the stuff in, it hurt a lot right here. And I've had trigger point injections there already, like over the years before they found out about the cyst. They used to inject here a lot, the scapula. This is the part that bothered me the most after the accident in 2006. Here was the part that burned a lot, like right at the scapula itself. And you know, when the man told me to cut my breast initially, I told him that all of that don't make sense, that why is it burning in my scapula and why is my leg changing color. I told my neurologist that it just don't make sense. It just never add up, because I am somebody who lecture about fibromyalgia, and I told him the fibromyalgia don't explain what's going on. The burn, it's like too much burning, and it going all the way down to the legs, and so it never makes sense. And I was right. It ended up being an arachnoid cyst on my spinal cord, and the spinal cord was getting squeezed by a cyst. So it's a layer in the spinal cord. It's a layer that is around the spinal cord that end up building up a cyst, and it push against the spinal cord. I wish I had pictures that I could show you guys. I wish I could show you the MRI with the cyst on it and the x-ray that have the metal rod, so you guys can see those things, but I just don't have them handy. I have to like upload it on the laptop, and maybe one day I can show you guys those things, you know. But the surgeon run through those things with me in his office and show me how the spinal cord look like a circle, and then as it's going down, it's squeezed like a football. It start looking like a football as it's going down instead of a circle. So you can see the circumference of it changing as you go down. Alright, guys. But thank you guys for tuning in. Big up and respect, and like I said, if you can donate towards my cause, towards the bikers, I'm just helping them with some care packages in the meantime, and I've collected like $30 so far, and that's been awesome. 2 people donate already, and I really respect that big time. That is better than nothing, and I can still send that amount of money to them. I have somebody in Jamaica who can give them the money for me, so that is all worked out already. So whatever you guys donate, we get it to them and we can help them out. So we help out some people, even if it's $1 that you can donate. All right, and I'm going to be working on the spinal cord education and all of those things separately, and that I would love to get help with as well, to keep the education going. Maybe get some shirts printed out so we can talk about spinal cord some more, and nerve things some more, and those issues. All right, guys. So my Instagram is timing down. My live is almost done on the gram. So big up and respect to everybody who is watching on Instagram. If anything, we'll link up later. All right. So big up and respect. And same to you guys on Facebook. Big respect to you guys out there. Love to you all. And like I said, if you guys need any help, link me medically for you or anybody else, your child, family, whatever it is that you're going through. I've had people reach out to me about their loved one who has mental illness and they've been institutionalized already, not taking their medication. They need a place for them to stay, so you know they can still get help again and all these things. So people going through a lot out there worse than us, you know, and sometimes we just can't do anything about it because they don't have the resources like in Jamaica, or they already went through getting institutionalized and was told to stay on medicines, and nobody can force anybody to take medications and all that, or vaccines, you know. So that is some of the issues that I notice some families go through too as well, you know, is that people don't take their medication for whatever reason. Sometimes medicines make you sick, is what I explain to some people as well. Sometimes medicines make you even more sicker or give you side effects, and the patients know that too, that they just don't feel good. So it's just to get, you know, to sort that out as well with their doctors and thing, and just get the right help. So anyway, I know I kind of went on a little tangent as well, because this is May Mental Health Month, and like I said, people have stereotyped me and didn't believe me when there was something really wrong physically, and that is what they always taught us when we're learning about psych and psychology. It's if somebody says something is way up in their nose and we don't believe, we should really check and examine. And there was a psych patient one time who was complaining about that, and it was true. There was something in there and they had to pull it out, and all these things happen in life where people don't listen and don't believe patients, and then it end up being a real situation. So the thing is, guys, just do your work well, like those professionals out there. As long as you do your work, document well, you know, take a good history and physical, and just consider these rare problems in the back of your brain, we should be able to help more people. All right, guys, so this is the real Dr. G, Dr. Karen Aneita Gaynair checking in, and I shall see you guys tomorrow if anything. All right, and like I said, link me, inbox me, keep in touch, let me know what's going on out there. All right, so we can get out of the house and link up. All right, guys, so take care of yourself, guys. All right, because if you don't do it, nobody else is going to do it. So just take care of yourself. Love.